TSDEU Clean Ethiopia 2030 Program Overview June 2025 Adama outlines national wash status. Why TSDEU Ethiopia Program Objective Component Expected Impact of TSDEU Ethiopia Progress so far. Challenges. Way forward. ETH or Ethiopia Household Sanitation Service or in the bracket GMP 2022 report. Safely managed 7%, basic services 2%, limited service 9%, and improved 65%. Open defecation 17%. Hygiene service in the circle 80%, 38%, 54%. 80% is basics, 54% is limited, 38% is no service. Drinking water safely managed 13%, basic service 37%, limited service 27%, unimproved 19%, no services 5%. What is TSDEU Clean Ethiopia 2013? TSDEU Ethiopia has a double meaning. Amharic Clean Ethiopia English represents total sanitation to end open defecation and urination Ethiopia. The vision of the TSDEU Ethiopia program is to see clean Ethiopia where citizens enjoy a prosperous life with dignity. TSDEU Ethiopia ending open defecation and urination by 2030. Why TSDEU Ethiopia? Total population practicing open defecation 115 million using unimproved sanitation facilities. Practicing open defecation 20 million using unimproved sanitation facilities. 75 million using improved sanitation facilities, 21 million. Total number of under 5 diseases per year. $177,849 under 5 diseases caused by diarrhea per year. 30,000 to 40,000. Ethiopia's share of trachoma burden in SSA 30%. Annual economic cost of poor sanitation ETB bir 15 billion per household without improved sanitation ETB bir 760. Productive time loss per person due to wash disease 11 days per year. Sanitation targets for basic sanitation services 100% by 2030. Interim targets 60% by 2025. Sanitation fact. Despite huge progress over the past 2 decades, Rwanda, Djibouti, South Sudan, Ethiopia. Rwanda 13 million, Djibouti 1 million, South Sudan 11.2 million, Ethiopia 25.3 million. OD Progress on household drinking water, sanitation and hygiene 20 up to 2017. Special focus on inequalities. New York, United Nations Children Fund or UNICEF and the World Health Organization WHO 2019. Population figures for 2030 retrieved from in Ethiopia. 20 million people still defecate in the open. 100 children die every day due to diarrhea. 11 productive days lost per year per person. 1.5 billion birr lost each year due to poor sanitation. Why TSDEU Ethiopia? Traditional interventions, substandard infrastructure, performance gap between regions. These two figures indicate the first figures, traditional interventions, substandard infrastructure. The second is performance gap between regions. Why TSDEU Ethiopia minimal success rate towards ODF or high slippage rate of ODF data and unavailability and inconsistency. Program objectives: 1. To achieve sustainable behavioral change towards utilization of basic and safely managed sanitation. 2. To achieve access to sustained basic and or safely managed sanitation infrastructure and services. 3. Ensure a strong and functional enabling environment or capable institutions, regulatory frameworks, resilient system. Program components. 1. Component 1, sustained behavioral change in basic sanitation services and hygiene utilization. These are preparation of strategies and materials. Behavioral change, ensure TSDEU or clean sustainability. 2. Component 2, sustained sanitation service chain. Development of context-specific hardware catalog, pilot and scaling up technology options, establishing of MBS system. Component 3, strengthening enabling environment, capacity gap assessment and development of capacity building framework, strengthening research and development on WASH. Fund rising for the entire TSDEU Clean Ethiopia and establish sanitation financing schemes. What is schemes? TSDEU Ethiopia implementation setting. 1. Household setting, rural, urban. 2. Institution setting, healthcare facility, school, religious, prison, office, etc. 3. Public setting, bus station, marketplace, public gathering place, etc. Implementation phases. TSDEU Clean Ethiopia is implemented in a phase-based approach. The overall program duration is 6 years and 8 months. That means April 2024, April 2024 up to December 2030. Phase 1, 2+ years, April 2024 up to July 2026. Reparation, piloting, expansion, and initial scale-up. Phase 2, 3 years, July 2026 up to July 2029. That means intensive nationwide scale-up. Phase 3, 1.5 years, July 2029 up to December 31 up 2030. That means completion, winding up, lesson compilation and sustainability planning. Implementation modality of TSDEU Clean Ethiopia. Social and behavioral change. The tables illustrate this implementation modality. Program financing total ETB 55.5 billion. Phase 1 43% ETB bir 24 billion. Phase 2 51% ETB bir 28.3 billion. Phase 3 6% ETB bir 3.2 billion. Expected source 30% government, 20% DPS, 30% community, 20% private and others. Expected impact of TSEDU Clean Ethiopia at different level. 1. Household community level. Reduce this burden, including NTD. Increase economic productivity. Improve quality of life. Promote dignity, particularly for women and girls. Expected impact of TSEDU Clean Ethiopia. 2. Healthcare facility level. Reduce the spread of infection. Improve quality of care. Reduce healthcare spending. That means medical costs. Reduce the spread of AMR. Increase healthy seeking behavior. 3. Schools. Improve school attendance and performance. Create a comfortable teaching and learning environment. Decrease school dropouts. 4. Other institution settings, social centers, cultural and religious events. Create comfortable working and business environment, tourist attraction areas, transportation routes. 5. Nationality. Improve the level in the Global Human Development Index. Economic benefits. Investing 1.02 billion for TSEDU Clean will bring a 5.61 billion return. Reduce all causes of mortality by 17%. Decrease under 5 child mortality by 20%. Reduce maternal mortality by 2.1%. Conserve environmental resources. This table shows indicators baseline year in the phase 2, in the phase 3. Indicator is OD. Under indicator, unimproved Latin EU under 5 mortality rate contribute to maternal mortality rate, contribute to the reduction of under 5 diarrheal prevalence. Baseline year 17% 0 20 400 2040000. Please look at this table, KPI in detail. Benefits or impacts. Household reduce disease occurrence, increase economic productivity, improve quality of life and the dignity of individuals. Community, creating a productive population and a healthy and a comfortable environment. Conserve environmental resources, promote dignity and comfort, particularly for women and regardless. Institutions, healthy, reduce the spread of infection, improve the quality of care, reduce healthcare spending, reduce the spread of AMR, and increase healthy seeking behavior. Continue schools, improve school attendance and the performance of students, specifically girls. Create comfortable teaching and learning environment, decrease school dropout. Others, create comfortable working and business environment at various types of institutions, social centers, cultural and religious events, tourist attraction areas, transportation routes. National, improve level in the Global Human Development Index, big economic return, investing US dollar 1.02 billion for TSEDU Clean Ethiopia by 2030 will bring US dollar 5.61 billion economic return, improving Sanitation will save to 2.1% GDP. Reduce all causes of mortality by 17%. Decrease in under 5 child mortality by 20%. Progress so far. TSDEU clean structure. TWG established. Concept note in the TOR developed and submitted for higher officials. Local health facility benchmarking conducted. An assessment tool has been developed. Facility selection criteria have been developed. Implementation guidelines and information manuals developed. 102 or 102 pilot were selected, started implementation. 3 pilot health facilities selected and on implementation in AA+, 1 baseline assessment conducted. Progress continue. TSEDU clean sites. The implementation started in Addis Ababa by HE Prime Minister. April 2016 EC with the motto or Tsedu Udaan Nuro Batena and aimed to have 7 clean sites in Addis Ababa. Ministry of Health in collaboration with stakeholders select different sites for the construction of 100 PTS in different sub-cities. Progress in rural setting in collaboration with regions. 102 pilot worlds identified. Training of trainers provided to all areas and stakeholders. The budget support provided for the implementation. Implementation on progress in pilot 50 worlds plus 52 equals to 102 worlds. ODF expansion. MEBS for access to basic sanitation. TSEDU institution initiatives. TSDEU clean institutions initiatives. The figure shows commitment of the leaderships. Implementation started with the lead of the HE Ministry of Health with the motto. This figure shows alert comprehensive specialized hospitals. This image shows environmental cleaning campaign week in hospital by all staff. Environmental cleaning campaign conducted every week in hospital by all staffs. Environmental cleaning, greening and landscaping is found in good track. Healthcare waste management system proved segregation to final disposal. Waste zone identified, delineated, fenced or alert. Sanitation facility inclusive public toilet in hospitals constructed. Hand washing facilities well maintained. Thank you.